from our audience here, and we'll start with Linda and do a 1-minute answer on this as well, I think. Health care for retirees and those contemplating retirement is a substantial portion of their cost of living. Many are on fixed incomes, raising concerns about rising costs. If elected, how would you view the state's role in providing enhanced health benefits at lower cost in the future with respect to new policies of the recent health care reforms?
First of all, I would say that the new Health Care Reform Act is a complicated act. I think we're years away from sorting out what the bottom line is in regard to that Health Care Reform Act. So I'm not sure that we know yet how that will impact our senior citizens. I think that there are some good things that we have seen out of that act to date, including the opportunity to insure your 26-year-old, up to 26-year-old children on your own health care, as well as the opportunity to allow certain persons who weren't previously allowed to get coverage because of pre-existing conditions. That would be something that would be of help to our senior citizens. In terms of what the state legislature can do to enact policies, I think that will be a growing concern, and I think that will be an area of emphasis as we see our citizenship age in the next decade or so, prioritizing how we spend our healthcare dollars and assisting our elderly in living independently and safely will be a priority for the state legislatures.
Thank you. Tony?
I agree. I think this is going to be a huge issue over the next few years, and as I said before, we're going to have to get a handle on this if we're going to manage healthcare costs. We don't know what's going to happen with this with the federal legislation, and so we have to wait and see how that's going to unfold. But here's some things we do know: that the population is aging, and so costs are going to increase for an aging population. It's just the nature of the lifespan. We know that if you can catch any kind of disease or any kind of illness early on, the treatment is always better, and it's almost always usually cheaper. It's when you let it go on for a while and get to a catastrophic situation that it gets very expensive. We also know that it's going to be important for people to have discussions about levels of treatment that they can afford. And that sounds harsh, but those are realistic discussions that we have got to have if we're going to think about healthcare in a reasonable economic way.
Thank you. Tom?
Thank you. I touched before on telehealth monitoring. There's a program where every day someone in their home is monitored for blood pressure, heart rate, 7 to 10 factors. And that data is monitored over a distance by a nurse who looks for changes. And those changes, when they occur, the nurse calls the patient's primary care physician, and they then can intervene. We need to invest more in high-speed internet services for health issues. An example of that, at my instigation, the Veterans Administration Secretary has directed the Kansas City VA office staff to work with KU Med to link the hospital systems in Kansas with the hospital systems in the VA system, so that patients, both civilian and former military, will have better access to health care over a distance.
Okay, thank you.